Okay, so we think we've got a live stream here. So my name's Dr. Allen, and Lisa, do you want to introduce yourself?
Okay, I'm Lisa Phillip. I'm a GP in Sheffield and also one of the governing body GPs at Sheffield CCG.
I'll just wait for a couple of minutes just because it's due to start at 6, so I don't want to kick off without other people catching us.
Perfect.
And I can see that it looks to be working, so that's good.
So doing my on call now.
How's your day been, Lisa?
Very busy. It's been one of those days. So yeah. But aren't they all nowadays?
Yeah. Okay, so we're a little after 6 now, so we'll kick off. So I'll just introduce myself again. So my name's Dr. Ben Allen. I'm a GP. I work at Burley Health Centre. I'm also one of the board members within the CCG. Lisa?
So I'm Lisa Phillip. I'm a GP in Chapel Green practice in Sheffield. That's the north of Sheffield, and also a governing body GP for Sheffield CCG.
So we were due to have Greg come with us today, but he's had a family emergency, unfortunately, literally like a quarter of an hour ago. So so we're going to be leading it. So hopefully we will capture some of the points that he would say, but it's a shame that he won't be here. What we'll do is we'll have a little bit of a briefing around kind of where we're at now with COVID and vaccination in Sheffield, and then we will and we've got a few questions that were submitted that we'll go through, and then we'll be freed up to be able to ask any questions that might be coming in. So we've got some other staff who'll be forwarding kind of any questions through to us. But I guess just as an introduction, really, just to kind of why are we doing this? And I think it's that we recognise that the situation with COVID and the situation with vaccinations, we've often been very much relying on the government for information, and it often has not been, information has been given to us, but maybe it's a little bit, we don't have that opportunity to wrestle with kind of what the information that we're given or questions that we've got, and as GPs we're often too busy to be able to answer lots of individual questions, but we wanted to have a forum that enabled us to be able to address some of the uncertainties, anxieties, and that's the idea behind it, really. Is there anything you'd add, Lisa, or?
No, I think that's completely correct. I think that it's important to get information out there that's accurate and, you know, really, really useful for people. And yeah, it's just nice to have local people giving advice to people in a local community. So yeah.
Okay. So so I guess just to explain what's the situation that we're in at the moment. So so Omicron is still, it seems to be leveling off. It's about 1% of the population of Sheffield were kind of got Omicron last week. So we're still very, very high in terms of transmission, but it appears to be leveling off. So it's not going up anymore. The restrictions as of last week, so all the face mask restrictions and the COVID passports, my understanding is that is stopped now. But there are still some rules around face masks and in health settings, and often, you know, that we still need to be a little bit careful about what the actual rules are within any kind of health organization, because obviously there's more vulnerable people there, and certainly whilst the rules around face masks have gone, I think that they are thought to be you know, a very simple and effective way of trying to reduce transmission. So whilst the rules have gone, as a principle, it's still a really helpful way to try and reduce transmission. So the statistics are around 80% of Sheffield have had have had 2 vaccinations now, and about 70% have had a booster. There is, it is definitely less than that, particularly in ethnic minority populations in Sheffield. Now, anyone who is over 16 is eligible to have 2 vaccines plus the booster, and anyone over 12 is eligible to have 2 vaccines. And we're also vaccinating children between 5 and 11 who are in an at-risk category, or who've got they're a potential contact with somebody who is vulnerable. So I think that's kind of a bit of a summary of where we're up to. I guess maybe the thing to add to this really is that whilst so Omicron does appear to be milder, and it has kind of leveled off in terms of the number of people who are, the infections increasing appears to be leveled off. The vaccines are doing a massive job at the moment. So it's around 50%. The effectiveness in terms of actually getting symptoms about 50%, and that has a massive knock-on effect to the people who get it, who are going to be transmitting the virus as well. So it's helping to limit the numbers, but it's also very significant in terms of the reduction in hospitalizations. So it's around 80% reduction in hospitalizations if people are vaccinated with a booster versus unvaccinated. So there's still a very significant benefit. So we'll come on to more of that later. Let me just see what else. That's the overview. So the first question was, why am I offered a different booster vaccine to my 2 previous doses? So when the vaccination program first rolled out, we had AstraZeneca and we had Pfizer, and we were using both of those. And it seems that at least at a booster level, it's the Pfizer and the Moderna vaccines that appear to be the most effective. So in terms of which booster to use, so we've pretty much completely moved over to those now. Now they're the most effective booster dose, regardless of what the initial vaccine, vaccine number 1 or 2 is. There's no evidence that mixing the vaccines is an issue of safety or anything, but the best evidence is for the Moderna and the Pfizer vaccines, and that's what we are giving at the moment. Yeah. Okay. So Lisa.
Yeah.
So we've got the question of I've put off having my vaccination during my pregnancy, and I'm still unsure about getting the vaccine. And I don't know whether it's too late.
Okay. So I think with pregnancy, there have been so many women who have, become pregnant since the vaccination program began, and people in the original trials for the vaccine that became pregnant, maybe weren't planning to, but became pregnant during the trial. So we have a lot of information and a lot of trial data now for safety of the vaccines in pregnant women. The Royal College of Obs and Gynae and also the Royal College of Midwives have they've issued advice about vaccination in pregnancy, and they've had a look at lots of numbers. So I think around 25,000 women have had vaccines and had babies, and they've noticed no difference in the outcomes, no more complications. I don't think there's any increase in problems for people with pregnancy. But what we have noticed is that when women are pregnant, it puts your body at a state that you are more prone to form blood clots and things like that. So you're high risk. So we have seen a lot of women hospitalized for COVID during pregnancy. So we understand that people are concerned about vaccinations in pregnancy. I know people tend not to do anything other than take paracetamol in pregnancy, but we do have a lot more data to support the safety of the vaccine during pregnancy. So I think I would encourage anyone to have theirs. It doesn't matter what stage of your pregnancy you're at, it's still not too late to have them, they're still available. Yeah. So I think you can go and have them at the Jessop's wing. I think they have a walk-in service there. So if you're thinking about it, speak to your GP, speak to your midwife, and you can go to the walk-in at the Jessop's and have your vaccine there.
So we've got the question of do the COVID vaccines have side effects, and that's putting me off. So yes, some people do have, you can get tenderness in the arm after you've had it. Some people can feel tired, have a headache, feeling achy and feeling a bit sick, you can take painkillers that can help. But I think the thing to say here is that whilst there are some side effects to having the vaccine, they're considerably less in terms the symptoms of the vaccine are considerably less than actually having COVID, and we know that there's a significant reduction in terms of your risk of having COVID. And I think it might be worth just kind of putting in here that there's some kind of concerns about kind of serious side effects, and even you do even know what all the side effects are. And I think there's quite an interesting story really around the AstraZeneca vaccine had an association with clots in younger people at the trial level when it was being kind of being trialed. That wasn't picked up, but at the level when we're now doing things at a population level. So in terms of the concerns that people have had around this study's all been done very quickly, and they want to kind of see how things play out over time. Worldwide now, the amount of data that we've got from COVID vaccines is absolutely enormous. I would be surprised if there's many things in the world that have had quite as much, has been given to this many people with such close studies. But something that was picked up very early on was that it had this increased risk of clots in younger people. And it didn't take long before we just said, okay, we're not going to vaccinate those people anymore with this particular vaccine. And so I think that's just an expression of how we are looking to find out what the side effects are. And we do want to lost my train of thought now. We want the vaccine program is here to save lives, and so we want to know about any risks and side effects, and we change the plans based on the information that we gather along the way, and that's very much happening. And it's, I think that we all feel very confident in the safety of the vaccine, especially in light of the fact that it is still very serious to get it, and especially for older people, and especially if you're unvaccinated. That's a really important point. So next question, can my 6-year-old be vaccinated, for Lisa?
Okay, so recently the vaccine program was rolled out to children between 5 and 11 who are at high risk. So these are children with learning disabilities, children who are immunosuppressed, children with diabetes and other conditions. And it was also rolled out for children in that group if they're living with someone who's immunosuppressed or someone that's at high risk. So they're advising that these children between 5 and 11 with these risk factors get the vaccine. So with the children, I think in this age bracket, you're invited for the vaccine by your GP, or you're invited by a hospital consultant or whoever's looking after your child. So you will be invited to get the vaccine in this situation. So please be patient. I know that it's taking a while for people to go through their registers and to recognise all of these children. So it may be that the hospital contact you first, but you will be contacted by someone to have your children vaccinated. Okay.
So we've got the next question. Why do I still need a COVID vaccine if restrictions are being lifted? Restrictions are being lifted because it appears that the risks associated with all the restrictions are now kind of being outweighed, really, and so the restrictions are being scaled back, because there's real advantages to not having restrictions. Although what I'd say is the reason that we are able to start having those restrictions reduced is because of how successful the COVID vaccine program has been. So we know that the vaccines reduce transmission and they reduce the risk of harms, and that's what enables us to reduce enables us to start getting on with life as normal. I think, though, we need to be very, very careful here, because I think we could be lulled into this false sense of security that hospitalizations are starting to go down now. We'll start to be able to carry on with life as normal, but COVID will still be around. But COVID is still as harmful as it always has been to unvaccinated people. And so I think that it's just so important that this message comes through, is that especially for older people over 50, the risk of getting COVID really starts to ramp up, and by 17, 80, it's very dangerous to get it if you're unvaccinated. And so I think that it's really important that whilst nationally the risk of COVID appears to be going down, it's still really important for those people who are high risk to be getting vaccinated. Have you got anything you'd add to that at all?
No, it's just so important, the uptake. I think we see that the numbers are going down, we see that the death rates have gone down, but people are still getting COVID, people are still dying. So I think we still need to be very careful.
I think maybe another point to address here is that people thought it's one vaccination, and now it's two vaccinations, and that's it. So they go, okay, we'll get the second one. But now there's a booster, and so people think, well, what's going on? Like, is this gonna, I kind of stretched to vaccine 2 or to vaccine 3, but this keeps on going, and is there going to be a fourth one? I think to say here is that at the beginning, we didn't know how things were going to play out. You have one vaccine. Are you going to remain immune forever, or is it going to wane? And we're always having to react to the evidence as it goes. So we knew that you need a second one, and we can see that even after the booster, that the effectiveness appears to kind of start to wane 3 to kind of 6 months, and so we are going to have to continue to deal with this as it goes on, and it's hard to know how it's going to play out long term. Is this going to be something a little bit like a flu jab that we need once a year, or is it that after you've had 3, the immunity stays the same? We don't know, and so we can't promise people that once you've had your booster, then that'll be it, because it's going to take time to unfold, and we're always trying to kind of do the best that we can with the information that we've got, and time is something that helps us as we go along, but it's hard at this point.
Yeah, and I think I'd add to that there's always data being gathered. They're always looking at that, and that changes everything. If things change, then there's a new plan put into place. But I think the key is that whatever is implemented is safe. And there's a lot of work that goes into the safety of all the plans that are rolled out. So I think we shouldn't worry about that, because a lot of consideration goes into it. I think with the AstraZeneca vaccine, for example, as you mentioned, Ben, it didn't take many complications for them to stop vaccinating under 40s. So they have a very low threshold to withdraw things. So, they are safe and effective.
Great. So Lisa, I know that you've had some experience of long COVID, and I think it might be helpful for you to just talk a little bit about what that's been like for you.
Yeah, I think with long COVID, just to address a couple of things, people feel that, now because of Omicron and lots of different things, that COVID is just like a cold and it's not that bad. And for some people, that is the case. But, for some people, they're very unwell. And even if they're not unwell to begin with, they can become quite unwell, and they can still suffer from long COVID. So I think the Office of National Statistics put the number of people with long COVID, it's about 1.3 million. And that's a significant number of people. And I think a lot of people don't really understand what it's like and how it affects you. But I think the most worrying thing for me of all of the statistics I've seen, and they're not sort of as accurate as we'd like them to be, because it's all based on sort of self-reporting and COVID symptom trackers and things like that the Office of National Statistics have looked at to get their numbers. But they've said around 77,000 of those people suffering from long COVID are children. So, we know that children haven't been too poorly affected by COVID in the acute phase, but 77,000 of them are suffering from long COVID, and we don't know how long that's going to last. So I think looking at the tracker data, they've seen that people who are double vaccinated have around a 41.1% reduced risk of developing long COVID than people who aren't vaccinated once they've had COVID. Okay, so it's just something to think about, because we're not seeing the death rates and things that we saw before, but there are other complications and other problems. So for me, I got COVID in March 2020 at the beginning of the pandemic. I think it was just after lockdown, and we were still working, we were still seeing patients face to face all the time. And I went off sick. I just got really tired one day and thought I had flu. I got I think from the time I walked from my car to have my dinner, I couldn't sit up at the dinner table. I went downhill that quickly and became quite unwell for a very, very long time. I couldn't breathe. I stayed at home. I didn't go to hospital. My oxygen levels would fall. I was lying on my side and my front because I couldn't breathe properly. And I was like this for a while, and then kind of improved a little bit to the point where I started to go back to work. Well, I went back to work for about 2 days and didn't last very long. And then I just crashed again after that. I had a lot of fatigue. I couldn't catch my breath. My heart would race all the time. And I was like this on and off for about 8, 9, 10 months. I was off work for a year. So that took me out for a year. I was very fortunate that I had a job that was secure, and I still had my job when I went back, but I know that a lot of people with long COVID have lost their job. They've lost their livelihood. 2 years later, and it will be 2 years in March since I got COVID, I'm still struggling. So I still suffer with fatigue. So I have to pace every day. I work 3 days a week. So I work Monday, Wednesday, Friday, and have a day off in between. And then I have the weekend to recover. I feel like I'm about 100. I honestly go to work. I'm so tired when I get home. I do my admin the next day, which is my day off, and I'm still working. I feel like I'm constantly trying to catch up. Some days are better than others. So some days I have a lot of it, well, not a lot of energy, I have more energy. So I know that I can get through the day. Some days I wake up and it's not great. And I really have to think about what I'm doing, whether I go back upstairs to get something that I've left in the morning. It's planning your day down to that kind of detail that you're dealing with. So I still have really low oxygen levels a lot of the time, and chest pain and lots of issues, and I can only work part-time. And again, I'm so fortunate I have a job where I can afford to do that, because I know a lot of people can't, and they're struggling like this, but they're having to work more and just feeling rubbish, or they've lost their jobs. So I think for me, it's made a really, really big difference. You know, I can keep going, and I'm a person who is always busy, but so, you know, if I keep going and people think it's just laziness or something, or you're just not trying hard enough, but I'm a person that just doesn't stop. So I keep going, and then I hit a wall and I physically will just crash. So there's no pushing through it, or, you know, nothing like that. It just doesn't work in this situation. So I think, you know, yeah, it's just made a big difference in my life, and it's making a big difference to lots of people. I also have brain fog. So once I'm tired, I can't function. I can barely type a sentence. So again, if I get to that point, then I can't work properly. So that, you know, it's just had a really, really huge effect on my life. And I really have to carefully plan to be able to function and do what I used to do. But I think, you know, we have lots of people out there who have possibly had COVID from the beginning, sort of March 2020, who weren't tested because it was only healthcare workers that were tested at the time. So I know that, you know, I had it because I had an antibody test. My PCRs were all negative, but my antibody test was positive. So we've got lots of people in the community who are struggling with long COVID, but don't know that they have long COVID. They just haven't been right. They've just been really tired. They've never been the same. They're struggling with things. They're getting the brain fog, the fatigue, and, you know, they don't have a label for it. So if, you know, if anyone recognizes themselves in my description, or if they recognize someone else that they know, then, you know, get them to contact their GP, because there's a lot of help available at the moment for people struggling with these symptoms. And I think with long COVID, it's such a difficult thing to assess. And it's, you know, there's around 200 symptoms that have been described in long COVID. So as you can see, it's quite complex. We don't know what it is. We don't know what causes it. We don't know who's prone to it. But I know that I was fit and well before I had this. I'd never been sick a day in my life. I was never off sick. I was healthy, and, you know, and I had nothing. And then it just floored me. So, you know, people think that they're young, they're fit, they're active, they run marathons. I have friends who ran marathons and can't run them anymore because of long COVID. So just think about that when you think about having, you know, the vaccines and things, and think about wearing masks and giving space and just avoiding spreading the virus, because, you know, the one surefire way of not getting long COVID is not having COVID at all. So just being careful and looking after each other, we can just reduce the transmission and just make sure that we don't have many more people suffering the way that I have been, and the way that so many other people have been suffering. Okay. Okay, yeah, so yeah, I think that's me. So it's so important to be vaccinated and to be careful.
Great, thank you, Lisa. Okay, so we've had a couple of questions come through. Let me just find those again. So, so we've had one about the timescales for children. So this is, we said, about 5 to 11-year-olds, of immune suppressed parents, and that they'd be contacted by the end of January, and that there's been that some people haven't been notified yet. So, so just to say then, so lots of people have been contacted, and we're expecting that everybody will be contacted by the end of the week. And the advice I'm seeing here is that if you've not heard by Friday, then you believe that your child is eligible, is to contact your practice to see whether or not you're eligible. And then there's another question here. Now I'm struggling to answer this one. I know that the Green Book, the COVID-19 Green Book, is very good, and I've been scanning through it trying to find an answer. And it's this question around so what's the time frame for 5 to 11-year-olds living with someone who is immune suppressed to have their vaccines after they've had a COVID infection? And if it's 28 days as opposed to the 3 months for the children, why is this? And are there risks to children? Are there risks to the children from infection from earlier, to do it earlier after infection, and what are the risks associated with for the children vaccinations? So I don't know. I'm not aware of the specific difference between the time frame between having a COVID infection and having the vaccine. There's been lots of these rules that have come out a lot of the time. Sometimes we can get a grasp of why, but it's always a case of somebody who, it's going to be people who are steeped in the evidence, really kind of trying to kind of play up, okay, what is it better to have it straight away, or wait for 28 days or wait for 3 months? There's obviously going to be a risk of getting it again between 28 days and 3 months, and I think sometimes that people are making pragmatic decisions and based on the pros and cons, but I couldn't tell you why that is. I don't know, would you know, Lisa?
I don't know. I did look that up, and it was 28 days, but I don't know if that's just because of the high risk of catching it again, because it's just, it's spreading mostly in younger people. So I think it's just probably being more cautious. Looking at the rest of the question, so risks for the children post-infection, is that? I don't know if that's risks after infection or risks after the vaccine, but I think, as I said, a lot of children are getting long COVID. So there's a risk of them catching the infection and having problems afterwards. The risks from the vaccine have been studied very, very carefully, because I remember having this conversation before the vaccine was rolled out for 12-year-olds. So, before they were included, all the evidence was looked at and all of the safety research was done, and it was found that they were safe. There were very, very, very rare side effects that have affected a few children. I think one of them, you've mentioned myocarditis in this question, and they found that some children got myocarditis. It was kind of a little bit of inflammation around the heart. It was very mild. It was very short-lived. No one needed any sort of hospitalization or anything. It was just pain relief and rest. So I think, and that was extremely rare. So most children have had their vaccines and been absolutely fine.
Yeah. So we had the question then about how the vaccine was developed very quickly. And I think it's important to kind of point out here that it was developed quickly because it had the resources that are just be unknown in the history of the world in terms of trying to develop things quickly. So there were no there weren't any shortcuts taken. It was just that the resources were so high that they were able to do lots of the processes back to back. But I think the other thing to add is, is similar to what I said earlier, really, which is that whilst the actual vaccine was developed very quickly, it's now been in massive use for the last few years. So whilst that initial phase may have been really accelerated, it's been given to millions and millions of people. And so actually, in terms of how well this is tested, there's virtually nothing out there that's being tested as well as this now. So I think that we can have such confidence in the safety of the vaccine now, and the fact that that initial stage was very rapid, I don't think should concern us at this stage now. Would you add anything to that, Lisa?
No, I'd say the same. It's gone through the same checks as as everything else does. They were just done at the same time. They weren't waiting for hundreds of drugs. This was a priority, so they didn't have to wait. It's like going through an airport. You go through the same distance, but if you go through express checkout, you just straight through. There are no queues. There's no waiting. So it's just the same thing. It was just sort of streamlined, but the same checks happened.
Yeah. Do you want to the question about the needle phobia? So some people are concerned about kind of having scare. They want the protection, but they're scared of the needle. And what can they do with that?
Okay. That's a difficult one. It is a very, very quick process. I think if you do have a needle phobia, it might just take a little more time for you to get to the surgery or get to the centre and just have time to relax. Sometimes we can, if you're that anxious about going and having something so people will come to us if they're having a driving lesson or a driving test, or they're flying, if they have a fear of flying and stuff like that. And you can get something to calm you down if you're that bad and you really want to have the vaccine. But, you can go to your surgery if they're doing the vaccines. And I think if they know you have a bit more time and someone that you trust who's going to do the vaccine for you. So that might make you a bit more comfortable. But I would just try and speak to your GP and see if there's anything they can help you with to get you to have it if you're wanting to have it. Okay.
Yeah, and I think just sharing your fears with us, because when the person who's doing it will be very, very experienced, and whilst they might just be kind of working very, very quickly, if someone says, look, I'm really quite worried about this, how can you help? And I think you'd find them to be very sensitive and to talk through some of the options. And I've just had a quick look online. I can see Guys and Thomas have got an article about overcoming your needle phobia. So Guys and Thomas, it's an NHS website. That might give you some tips that are helpful for you.
Yeah.
Okay, so let me find my way back to the questions. Let me know if you spot one, Lisa.
Okay, I'm just looking through the list.
Chat. Are you happy with are you happy with the Sheffield rollout of the 3rd primary and 4th booster vaccinations? Am I happy? Well, I mean, it really happened very, very rapidly. Omicron came around. The evidence for the boosters in it came around, and we had not very long to act on that, and we just pulled out all the stops and vaccinated loads and loads of people. And whilst it's exhausting for general practice to do that, we're here to save lives and to make people's lives better. And so when something comes along and we see the evidence that it was really helpful, then we just pull out all the stops to do the vaccination. So it was exhausting, but I think there were a lot of lives were saved because we rolled it out so quickly. So I don't know if that answers the question, but I think it was the right thing to do.
Yeah, definitely. Yeah. So I can see one here, someone heard about different things in the vaccine. So the ingredients for every vaccine are on the website, so you can see them. I can say that none of the vaccines that we have and that have been approved have anything, they're all vegetarian. They have no meat products in them whatsoever. So, they are vegetarian, and there is a list of ingredients on each site for each vaccine. So you can see those.
Okay, so this question. So my children have been coded but not contacted. The GP doesn't know anything. The CCG report meeting with Sheffield Children's this week. Why has sites of vaccination for children in this circumstance been identified? Where in Sheffield are these children being done? So my understanding is that they'll be offered a vaccine within the primary care network or a GP-led clinic or at the children's hospital. Do you think you able to answer that question? Have I understood that question, Elisa?
No, I would say the Children's Hospital. I would think that they would be rolling this out all the time, because in the different GP practices, I'm not sure if a lot of them are vaccinating, and I don't think these children can go to the vaccination sites. Correct me if I'm wrong, but I'd say contact the Children's, and they should be able to direct these children, because there must be a service because they've been called.
Mm-hmm. Yeah. Okay. So I'm still waiting for some more questions to come through, but I think there's a few bits that I thought would be worth going over, just in terms of some of the kind of the fears that we've heard from people. Might just be worth just running through, really. So there's been some people who don't want to have the vaccination because they don't trust the government, and the government's obviously been very much kind of rolling out the COVID vaccinations, and I think the thing that I would say to that is that there'll be lots of different opinions about how much we should trust the government. However, regardless of what you would say about that, the medical profession are absolutely behind the importance of vaccination. Over and over again, we've pulled out all the stops to help vaccinate people because we have seen the evidence, and we believe it to be effective. So I don't know whether you add anything to that, Lisa, at all.
No, I don't have that. I think I have a comment that kind of ties into that. Someone thanking me for sharing my story. I feel like if I can help anyone, I will talk about long COVID all day long. But yeah, they were saying that, you know, we're being fed the narrative that all is well. I think things are better than they were before, but they're not well. And that, I think that's the purpose of us having this discussion, so that we can be frank and open and honest and say that we still need to be careful. We still need to look after each other. We still need to think about being vaccinated, you know, a vaccination, because we've shown, you know, there are lots of things that we don't know about, you know, COVID, the vaccinations and things, but we do know that vaccinations have saved lives. We do know that they're safe, because so many people have had them, and we do know that they're effective. So, you know, they're the things that we have, and they're the things that we should sort of run with. And then we as we gather more and more information, and, you know, we just keep learning. We have feedback from yellow card reporting, and that's sent on a weekly basis and for people to analyze. So there are so many people looking into the safety of these vaccines. I don't think there's ever been a safer vaccine. It's, you know, there's so many people monitoring it.
Great. Yeah, and just on the booster program, I think that Sheffield, in terms of the number of people boosted, it's the highest number in any major city. So we're a very well vaccinated city compared to most. And showing if there's anything else. Yeah, so something I've heard is that some people point out that I know someone who had the booster and they've had COVID. I've had no vaccinations and I've not had COVID. Therefore, I'm not sure that vaccines work. And I think this is, again, something that can kind of get lost in that. There's been very simple. The government and often the NHS have gone for very simple kind of messaging, and often the complexity sometimes gets lost. And I think that's why you can have people seeing that and thinking, well, does it really work? The point here is that vaccines decrease your chance of getting COVID, and they significantly decrease your chance of being hospitalized and being in hospital. But no medication or vaccine is 100% perfect, and so that's why you can still get people who have done everything right and still have a bad outcome, and you can have some people who've not been vaccinated and haven't been careful who don't get COVID, and that's still possible. But it doesn't mean that the vaccines were not effective, because there'll be individual cases that go against the trend. But when you put together millions of people, then that's when you find out whether or not it works or not. And we do know that it works, but that doesn't mean that there's still not going to be anomalies around. Yeah, were you anything to add to that at all, Lisa?
No, I think I think of all the vaccines that we have, this one has definitely sparked the most discussion and controversy. And I think we have a lot of evidence to prove that the vaccines are okay. And I think everyone is entitled to freedom of speech and things like that. But when you think that someone may have COVID and it might feel like a cold and it may not leave them permanently, disabled or something like that, and then someone else can get COVID and die. When people are putting people off of the vaccine, it could cost someone their life. So it's quite serious. I think we just have to think very carefully about what is out there and what we feel about the vaccines and what we hear, because people are hearing a lot of stuff. So what we always say is that if you want to know about the vaccines, come to these events. We'll talk about them. Go to the websites for the pharmaceutical companies. They tell you everything about their vaccines, all of the ingredients. They tell you their study process, their trial data's there. They have become quite open and transparent during this period, and I don't think we've ever really seen that before. I know people, they don't trust government, they don't trust pharmaceutical companies, but I would say actually over the last year or so, they've really stepped up and really been really open and frank and honest and, very transparent with their websites and all of the information that they put out there. So I don't think we can sort of use that sort of justification anymore. And I think we're all sort of working together a lot more than we used to. So I think, we've really come a long way, and COVID has lots of negatives, but there are also lots of positives as well.
Yeah, and whilst one of the criticisms of pharmaceutical companies could be that when they do their studies, that you start to ask questions about the transparency and whether they've reported everything, whereas we're way beyond that now. We've got the vaccines are all over the world, and they're way beyond any kind of pharmaceutical control. So if there was any concern that was affecting what we know, we've gone way beyond that now. And any potential serious risks are being tracked, and we respond if there's anything that we see that suggests that the vaccine is less safe than being vaccinated, than being not vaccinated. So I think we're kind of coming towards the end, really. So we're just trying to think about a roundup, really. So
but there is there's an answer to one of the questions. So we weren't really sure about the children. We said the children's. So they'll be offered a vaccine within a primary care network. So if the network is offering vaccination and with a GP-led clinic, or it's at the children's hospital. Okay. So I'd say children's is probably your best bet.
Okay. And there's one more just come through. Can you see that one, Lisa?
Let's just have a look. So I can see a third dose given after 8 weeks. So some people have a third dose of the vaccine. So people who are immunosuppressed and on certain medications with any immune disorders, their immune system won't react the way that someone else's might. So they might not make the antibodies and things that they need from the vaccine. So they're offered 3 doses. And then they have their booster. So they have their first 2 doses. And then I think the third dose is given at 8 weeks. So that's 2 months later. And then they have their booster at 3 months. So that's their scheduling. And they should be called for those. But again, if you haven't been called and you are immunosuppressed and you haven't had 4 doses, contact your GP and you can have those. Or you can go to the walk-in centres if it's been weeks for your third one or 3 months for the 4th one.
Great. So we'll be rounding things up now. So thank you all for coming, and thank you for the questions. I think it's really important, if there's anxiety around any medical intervention, that you get to understand a bit about a bit more detail and be able to ask questions. And I think that has been a concern over the time. So I'm hoping that this has gone some way to kind of help people to be able to grapple with some of these difficult questions and hear a bit of a fuller answer than maybe you'd normally get. The risks nationally of Omicron appears to be kind of plateauing and going down. The rates are plateauing. The vaccination program has been successful in reducing the harms, and I think I'd just say that it's so important, if you're somebody who's unvaccinated and unboosted, the benefits that we're seeing nationally are not going to apply to you in the same way. And it is still a risky virus, both in terms of hospitalization and in terms of long COVID. And it's really important to be vaccinated, and we would really recommend that. And that's especially true if you're over 50, even more so over 70 and 80. The risks in those groups are definitely higher. But it does seem that in many ways the suffering that's gone on through not being able to live our life as normal appears that we're going to have at least a period of time coming up where we should be able to have some of our life back as normal, which is great. So I think that concludes us for today. Thank you for watching, and I hope that we've been some help to you all.
Thank you so much, everyone. Thanks, Ben.